Same-day total joint replacement is really exciting, and it's the direction in which I think most hip and knee arthroplasty is going now. Traditionally, patients would be expected to stay in hospital for several days, but now with the involvement of multiple different specialties, with patient education, with trying to change patient and relatives' expectations of what's going to happen after a joint replacement, it really is now a possibility.
And it's inevitable, I think, that the majority of patients now will want same-day surgery, and it's something that we do safely with no particular fuss, no particular complications. It feels very routine. Patients come in the morning, they have their surgery, and they usually head off home perfectly comfortable, or as comfortable as you can be after surgery. Head off about 3 to 4 hours after they come out of the operating room.
The decision as to whether anybody is a candidate for this outpatient surgery boils down to the fact that anyone in theory who is fit to undergo the procedure itself is a candidate. Sometimes they have other circumstances such as their family situation, but in principle everyone is a candidate and it is an option for everyone. The process in preparing patients or deciding whether they are a candidate for surgery involves bringing them into the office, taking a full history of their problem, examining them and doing appropriate investigations. If their arthritis is severe enough and it warrants surgery and they have failed all non-operative measures, then we talk about the surgical procedure and the potential planning for that.
Patients arrive on the day of surgery. I meet them in the preoperative area. I check the paperwork, I check the consent, I talk to the patient and see how they're feeling about the day. I mark the skin and we take them through to the operating room. They wake up shortly after the surgery in the recovery area where we make sure they're comfortable, make sure they're not feeling unwell. We tend to use short-acting anaesthetics now, so usually about 30 minutes after their surgery they are fully awake, not feeling sick and feeling comfortable.
We've got a great team of dedicated nursing staff there that will look after them as they come to. They can expect their legs to feel numb. That's normal, that's to be expected, that's what we want. But gradually they will find that their legs come alive again and they can start moving their toes. They may notice a small amount of pain coming, or certainly an unusual pain or a dull ache. But for the most part, people are generally really surprised at how little pain they have. And that's, I'd love to take credit for that, but that's really down to the anaesthesia team and the combination of the spinal anaesthetic with any regional anaesthetic. And sometimes the injection cocktail we have used to help control inflammation around the surgical site.
For some patients who do have pain when they emerge from the operating room, there are multiple different types of medications that can be given either intravenously or by mouth to reduce that pain. It's not realistic to expect no pain at all, but certainly there are plenty of people on hand to provide adequate management, particularly in the early phases, within that first hour after the operation.
They can expect to be slightly unsteady because they will have some painkillers on board, they have had sedation, but they can also expect to be using a walker or at the very least a cane, usually a walker or crutches, and to be taught and schooled onto how to use these walking aids to take the first few steps. And I think that's the big thing for patients, is that they realise as soon as they're up and they start moving around with some help, before you know it, they've taken a few steps on their own with their walker, and I think that's really when they realise that same-day surgery is a reasonably good option for them, and why can't they do this at home?
So part of it, deciding whether patients go home, is professional, but most of it is driven by the patient. Who says, yeah, I'm happy, everything seems to be working, the pain's not too bad, I can pee, I can eat, I can drink, I don't feel sick. Sure, I'm going to head off home because I want to go home. Occasionally people feel after their surgery they can't go home. That's absolutely fine. And that seems to be less than 1 in 10 patients feel that actually they just can't face going home for whatever reason. Sometimes it's because they have some pain, sometimes because they feel a bit sick, or sometimes because they just think, oh, I'm a bit anxious, a bit scared. That's fine, we've got a bed for them.
Following the procedure, the next medical input really is home care, which involves either physical and or occupational therapy, who visit the patient hopefully within the first 24 hours of the surgery, and they ensure that the patient is doing well enough at home with pain control and mobility and checking their dressings. And so that's one of the crucial steps in the post-op phase, and that we have close contact with the home care team, so that if there are any issues they can always call us at short notice and keep us informed as to how people are progressing. We also have a very good nurse navigator who contacts the patient by phone the following day to ensure again that things are going relatively smoothly and they're coping at home.
We have the ability to send people out to the patient's home and to go through and to receive the care there that they would receive if they were in hospital. And that provides, I think, a really reassuring link for the patient that they are not going home, they haven't been abandoned, they don't, if they're scared or they have questions, then the home health team are there to answer those questions. And if they can't, then they can very easily get in touch with the surgical team or the total joint nurse navigator and have those questions answered.
And then we expect the patient to come to the office for outpatient therapy. Outpatient therapy usually lasts about 6 weeks, so in total folk get around about 2 months of therapy after their surgery. If they need more, then we fix that, and if they're good to go prior, then that's fine as well.
I think patients and providers are realising that why does the patient need to stay in hospital while that happens? If we can provide the support that patients need in their own home, which is what we're really great at doing here at MaineGeneral, then why not have that as an option for the patients? And we're seeing more and more and more patients asking about the option, and in fact, requesting same-day joint arthroplasty, which is excellent.
We collect a lot of data on our quality. So we ask patients to fill out a number of questionnaires prior to surgery. We then follow up with the questionnaires later. We can then use those questionnaires to see how things have changed for the patient during the course of their surgery. Hopefully they have all improved. We can measure how actually that improvement is. And we're keeping a very close eye on our data collection results, comparing our same-day surgery to our overnight stay surgery patients. We also compare ourselves to nationally published data in terms of how good are we in terms of what we do here for patients, what is the quality of our surgery, and our results show that we are as good as anyone else. I've compared my data to the Hospital for Specialised Surgery, and my outcomes are as good as the New York data.
I think the most important thing is that there really is no place like home, and patients prefer to get home, be in their own environment with their home comforts, and it's just as good as being in the hospital.